Thanks for joining us in the Navigant Credit Union Broadcast Center. I'm joined with Dr. Eric Roseen with Boston Medical Center. So just a couple weeks ago, there was a study published in the Annals of Internal Medicine. Researchers, including Dr. Roseen, found that yoga classes designed for chronic lower back pain produce similar outcomes compared to physical therapy, and really helped reducing pain. So wanted to chat with him. He was involved in research in the study to chat about this and their findings. So Dr. Roseen, thanks so much for joining us.
Thanks for having me.
Yeah, so I appreciate your time today. Tell me a little bit about what went into this study and what you found.
Sure. Back pain is a very common, big problem. It's the leading cause of disability worldwide. A number of studies, including previous studies at Boston Medical Center, have shown yoga is an effective treatment for chronic low back pain. But most of those studies have been done in predominantly white, middle class, or middle income participants. And at Boston Medical Center, we're a really large safety net hospital, and we serve a very diverse community. So we feel it's really important to test yoga in a more diverse and underserved community to see if it's well received and if it's an effective intervention. So we enrolled lower income, racially diverse patients to participate in a study of yoga and physical therapy, which physical therapy is another very common treatment that's thought to be effective and is typically reimbursed, and primary care providers are familiar referring people to physical therapy. So we thought it would be a good comparison, another effective treatment. And our results are that for reducing pain and improving physical function, yoga was as effective as physical therapy. The participants who were in the yoga group reported that as their pain intensity improved, they were able to do more physical activities, and we had a number of patients who reduced their medication or did not need to take medication by the end of the intervention period, which was 12 weeks.
Wow, that's pretty incredible. So when you're looking at these kinds of studies and these kinds of findings, that's pretty incredible, although maybe it wasn't as surprising to you going into this study. Did it matter what type of yoga and what type of exercises that the patients were doing? Because some yoga can be very challenging and very difficult, and then other poses and types of yoga activities that you're doing could be very beneficial. So does it matter what type of yoga that you're doing?
Yeah, I think it definitely does. For this study, we brought together experts in the yoga field and in the back pain field, and we designed a yoga class for people with chronic low back pain. So it was kind of a gentle introductory class that may be very different than some of the classes that are in the community. And a really important next step is to one, see if this type of treatment can be embedded in a hospital setting or a community clinic setting, and if that's a feasible way to do this. But also, two, to see how yoga studios, different yoga classes in the community, how effective that really pragmatic intervention is for chronic low back pain.
Yeah, no kidding. And when we're looking at this kind of study, I mean, obviously there is such a problem with pain management and prescription medication.
Mm-hmm.
When you're doing a study like this, is that when it comes to reducing pain medication, whether it's just over-the-counter medication or narcotics, is a study like this is always trying to reduce pain medication? Is that always kind of on your mind as a doctor or physician?
Yeah, absolutely. I mean, the things that matter the most to the patient are typically their pain level and if they're able to do their physical activities or or go to work, kind of functional limitations. But yeah, it's a really big concern right now is reducing pain medication use. Even NSAIDs, if they're used over a long time, like Advil, they can have harmful effects. And certainly the opioid epidemic is on the top of everyone's mind. Recent guidelines from the American College of Physicians has kind of put non-pharmacologic therapies like yoga, like massage, like acupuncture as the frontline treatments for back pain. So before someone has an NSAID, they should get a massage, or they should see a chiropractor, or maybe try a yoga class.
That's great, yeah. So when people are finding out about this study and they're finding out about this research, and someone has, whether it's just episodic lower back pain or chronic lower back pain, is it a good idea to just go jump into a yoga class, or what's kind of the next step? And you kind of mentioned, possibly incorporating the classes into hospitals and into different things. But what's the next step for someone if they have issues with their back? What's the next step for people?
Right. Yeah. So if you're someone with back pain, it's always good to talk to your primary care provider, or touch base with them. But it's good to find a yoga class that's maybe a little bit smaller. We had about six people in each of our classes on average, and to make contact with the yoga instructor, let them know that you have back pain, and they may be able to help you modify any positions that you find challenging or painful, and then just know that you don't have to do exactly what everyone else in the class is doing. That it's okay to modify. It's okay to sit out some of the poses.
All right, and do you think that to continue, this has been a big research endeavor with you and with Boston Medical Center, do you think as we find more research going into this kind of thing that it's possible insurance will cover yoga classes?
Yeah, I think it's really important. We haven't completed our cost effectiveness analysis, but that's one thing we're looking at for this study. But that's something policymakers should really take a look at is what treatments are cost effective, safe, and how do you improve access to those treatments across all communities. I think that's very important. We're also really interested in finding ways to identify patients who are most likely to respond to yoga or respond to another intervention like spinal manipulation or acupuncture, so that they can get the right treatment at the right time. So there's lots of important questions left, and we're definitely going to continue this line of work in our research.
I like that. Well, hopefully we can stay in touch, and you're going to keep us up to date on what you continue to find. We'd appreciate that.
Absolutely.
All right, Dr. Roseen with Boston Medical Center, we appreciate your time. Hopefully you enjoy your weekend and enjoy your 4th of July. I appreciate you chatting with us today.
Thank you. Happy 4th.
All right, take care.